Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, February 9th, and we are here to take your questions about COVID. We have been doing this for a year at this point, and still always happy to hear what's on your mind. We, as always, will take your questions in the box below or with the hashtag AskDrArwady on either Facebook or Twitter. And we've gotten just a lot of questions in about where are we in Chicago, what's happening related to vaccine numbers, even a number of questions about some of the new vaccines that are coming out and how quickly might we have more vaccines. So we actually pulled together just high level a little bit of a presentation that we're just going to walk through instead of going to the data dashboard. All of this data, though, as always, is at chi.gov/COVID- for our dashboard, and then chi.gov/COVID-VAX, VAX, for all of the vaccine data, and they're connected to each other. So let's just go ahead and take 5 minutes and talk through this, and then we'll get into your questions. So first of all, this is just data showing where the United States and Illinois are. And what you can see is that both in the US and in the state, we've seen very nice improvements in COVID cases. Down 31% over the last 14 days in the US, down 38% in Illinois. And generally, even though it's the dead of winter, February, we are very much seeming to be past our peak as a country, which is good news, but we've got to be careful. And here is just, if you don't look at this, this is from the New York Times, but this gets updated every day, and I think they do a nice job pulling together data from local government to take some data from Hopkins. And the darkest colors are where we're seeing the highest number of cases per 100,000 in the past week. And that's the most standard way to compare the outbreak across the country. And so you can see on the right there, Illinois is generally that lighter color in the somewhere between 10 and 30 cases per 100,000 per week, and Chicago is really doing well. Cook is 80th out of 102 counties in Illinois. Lower is better. You don't want to be in the high numbers. And in terms of the states, really the U.S. broadly much better. You can see those darkest areas are in the states that are having the biggest outbreaks right now: South Carolina, Arkansas, Oklahoma, Texas, and Kentucky. Illinois is doing 36th. Again, lower is better. And if Chicago were a state, we'd be 45th. So we're really making very good progress. Oh, I will just note, we updated the travel order today too, related to this. And we are just starting, for weeks now, Hawaii has been the only state that has not been subject to either quarantine or pre-arrival testing when you come to Chicago. And as of today, we were able to add 2 more states, Alaska and North Dakota. So if you are excited about traveling to Alaska or North Dakota in February, you now can travel and return without needing to do that quarantine or the mandatory testing. But really the strong recommendation is to avoid non-essential travel. Variants are on the rise. Generally travel is a concern, but that is some progress, and we're getting close. Chicago's at about 17, 18 cases per 100,000 per day, and that cutoff is 15 related to travel, and there's a lot of states that are getting really close. So I expect that we'll see even more improvement probably with the next update. Okay, then just quickly, where are we on cases? So our numbers are looking good here. We're averaging 493 new cases per day. That dark blue line is our rolling daily average. You can see in the lighter blue are the individual days. We had some days in our second peak here with more than 3,000 cases a day. We want to get back under 400 new cases per day. We're getting close, but that's when we really come out of that higher risk territory as defined nationally, internationally, and locally here. So that's looking really good. And then exciting, we are finally just under 5% positivity. That's a really important metric for us. If you remember, that 400 case mark and that 5% positivity are the same metrics we've been using all the way since last June. And so both today and yesterday, we were at 4.9% test positivity. Both our test positivity and our cases are where they were really in early October. And progress is looking good. We've also gotten some questions about hospital capacity. I thought I'd just show this to you quickly. This is our non-ICU occupancy. These are how many people are in Chicago hospitals with COVID-19. And you can see In our first peak, we had more than 1,200 people on average, not in the ICU, but taking up other hospital beds. Over the summer, we were down to under 250 people in Chicago hospitals with COVID. And then in the second peak, we got up to about 1,100 again at the peak, and we're down to under 500. So making progress. Our hospital capacity is adequate. We've got about 22% of our non-ICU beds available, plenty of capacity at this point. And then similarly, here's our ICU occupancy. So you can see here, really in the first peak was when we had more people in the ICU, an average of 500 across Chicago hospitals at the worst of it, down to about 77 at the lowest. Over the summer, got up to about 300 again, and we're back down to about 150. So ICU capacity also looks good, 29%. I will say thank you to everybody who got a flu shot this year, who has been masking and social distancing and hand washing. Even if you're doing it for COVID, it has really helped us with hospital capacity because we have not seen influenza hit hard at all. Normally, February is a major time where we see a surge from flu. Luckily, we've really been able to avoid that, which means we've not had as much stretch from COVID. So thank you for that. It's an indirect benefit of doing the right things for COVID, but that's been really helpful. All right, some vaccine data quickly. So at this point, we've administered 339,101 doses at Chicago sites. And that means City of Chicago vaccine going to these sites. And you see that about 63% of that has gone to Chicago residents and about 37% to non-Chicago residents, or there's a very few where the residency is not reported. And I do want to highlight that we want to vaccinate people who live or work in these high-risk occupations in Chicago. So a lot of these people are people who work at our hospitals or who are working in the grocery stores or the education sectors or other settings where we definitely want people to get vaccinated. But one of the things we're noting is that we are doing a lot of vaccinating of non-Chicago residents. But then in contrast, there's been 270,000 doses administered to Chicago residents, 78% of that at Chicago sites. But I do want to point out, 58,000 of those doses have been at non-Chicago sites. And this just points to why we do have, really good agreements in place with Cook County, with some of the other areas around us. Again, if people are working in they live in Chicago, but they work in a factory, for example, in suburban Cook, or we've been vaccinating correctional officers, for example, over the last week or two. A lot of them live in suburban Cook, but work in Chicago. We really collaborate there back and forth. But this is where we are. 1 in 13 Chicago residents have gotten at least a first dose of the vaccine. 1 in 12, it's probably even higher than that now, have gotten a first dose of vaccine 18 plus. And we're up to 1 in 6 Chicago residents 65 plus that have gotten a first dose. You can explore if you want to see how the first and second doses are breaking down online there. The blue represent our first doses, the green represent our second doses. Again, your second doses come 3 to 4 weeks later. And so we're doing a lot of work behind the scenes to make sure that all of the sites are getting the right amount of vaccine to be able to give those second doses on time. And then just to put that in some perspective, there have been more than 270,000 doses that have gone to Chicago residents. That's already more than 30,000 doses into Chicago residents than we've ever had diagnosed with COVID. So we are making very good progress. The U.S. has done, the most COVID vaccinating by far. About 1 million doses going into arms across the country every day right now. Obviously, we want to be efficient. We want to move as quickly as we can. But this slide right here answers about 92% of the questions that I'm getting right now, including for many of you. A lot of the questions that I'm getting are about why can't we put additional people into 1B? Why can't we open larger mass vaccination sites? Why can't we do more in more communities? Why can't we do at XYZ? The answer to every one of these questions has to do with how much vaccine we're receiving. So to put this in some context, I made this little pie chart here. That green represents the number of Chicago residents who became eligible in phase 1B for vaccine. There's about 363,000 Chicago residents who are 65 and older, and another 350,000 Chicago residents who are in those eligible frontline essential worker categories. So we've got more than 700,000 Chicagoans who became eligible, not even including the people, the healthcare workers from 1A who maybe now are feeling like they want to get their vaccine. So that's the pie. And then those 4 little slices out of the pie represent how many first doses of vaccine we've gotten each of the last 4 weeks. The pink is our current week. We're getting 42,050 first doses, pretty much divided between Pfizer and Moderna, which works out to 6,000 first doses per day to stretch across the whole city. And if you look back, that has been going up. Last week we got 5,700 first doses per day. The 2 weeks before that, we were just under 5,000 first doses per day. I do expect we'll be getting a little bit more here. We're hearing we may get 8,000 more doses through the pharmacy for the week, for example. But in terms of seeing really major increases, I don't expect to see major increases for at least 2 to 3 weeks. This is what we're hearing from the federal government. The new administration has been trying to give us more of a runway here, as opposed to us finding out just 4 to 5 days in advance. They've been really trying to project out 2 to 3 weeks in advance. And so this is the answer to why I can't find an appointment on ZocDoc. This is the answer to why I still haven't been able to get in. And I will note that we are just 2 weeks into phase 1B. I do think that we're likely to see vaccine increase, particularly in March. And I've got a slide in a second about that because I know you have questions. But when I urge patience, it is just because of this graph. And although I'm really pleased 1 in 6 Chicago residents over 65 has been vaccinated, and our equity data on that actually looks quite good as well, nevertheless, that means 5 out of 6 Chicagoans over 65 are still waiting to get their first vaccine. And we have gotten 1 in 6 done really just in the last couple of weeks. And so I'm optimistic that we will get through this group. We're getting through the essential workers, lots of planning. But remember, most people are going to be vaccinated really in March. And where appointments are coming available, you'll note a lot of them tend to be in March, maybe even in April. If we don't get significantly more vaccine like we're anticipating, it's possible we could have to push the date that we move to 1C back, but we're not, at this point, we're sort of going with the projections that there will be quite a bit more vaccine. And I also just wanted to emphasize that people in 1B would continue to get priority, even as we move into 1C, if they haven't gotten vaccine. So in the same way, the City of Chicago pods, we're still vaccinating a lot of 1A healthcare workers at the beginning and when we were formerly in 1B. We would continue to do that. We will work to make sure everybody who wants vaccine in 1B is able to get vaccine, but it is going to take a little bit of time. 99% of our allocated doses have been pushed out to providers. This was a goal we set from the very beginning of our response here. I felt from an efficiency standpoint it was critical that we did not have doses sitting on the shelf at the federal level, sitting on the shelf at the city level. And so that black line shows you see it's kind of bumpy. That's because we get doses they come in once a week. We get a weekly allocation of it. And then that red line is as we push it out to providers. And so we set a goal of 95%. We've been meeting that. We're actually we're at 99% allocated doses pushed out to providers. And then we're at 88% of those doses administered and reported 7 days after delivery. That's if we set aside the ones that are administered by the long-term care facility program, because for that program, we had to save doses that are then used over January, February, March. So setting that aside, we are now at 88%. A week later into arms and reported. And, huge thanks to my team that's been working to help the computers talk to each other better, help make sure that providers are getting the support they need. Every week we get requests in from our more than 500 providers now across Chicago who are eligible to get vaccine. And we look to make sure that all of their reporting is happening appropriately. And we look to make sure that they're using 85% of the doses that they received the previous week. So we met our initial goal already of 85% here. We'll probably aim for 90% next. And then my last slide is just to talk through, because we had a lot of questions about what's happening with vaccine development in the US. So as you all know, the Pfizer and the Moderna vaccines have that emergency use authorization from the FDA based on excellent safety and efficacy profiles. Those were excellent in the trials. They've continued to be excellent in all of the monitoring that we've been doing now that millions of people, more than 40 million people have gotten the vaccine. Those are both 2-dose regimens in use in the US. The next one we've got our eye on is the Johnson & Johnson vaccine. Also, it's done in conjunction with Janssen Pharmaceuticals. They have now submitted their trial data to the FDA for review. FDA is reviewing it. This is where all the independent scientists look at every bit of this data. They really want to make sure the safety is good and the efficacy is good. And so that takes a few weeks. The advisory committee meeting is scheduled for February 26th. If the FDA then, if the advisory committee recommends that the FDA grant authorization, the CDC then meets through its advisory committee on immunization practices. They make the recommendations about use of the vaccine. This is the single-dose vaccine, so there will probably be some interesting guidance related to use there, and we can answer questions if you're interested. So this, based on the preliminary data that we've seen, looks good from a safety and efficacy perspective, and we think it probably could start shipping in early March. Just like we did for the Pfizer and Moderna vaccines, we'll have people here looking at all of that data, making sure we can explain to you all the details of that vaccine as well. So that's really promising. And then there's 2 other vaccines that the US has really supported a lot of development of that I have them in orange here because they're kind of maybe next in line. The AstraZeneca or Oxford vaccine, it is in use in the UK and in Europe and some other settings. There's been some single-dose use setting there, and there are ongoing US trials. You may have seen the news that South Africa just stopped using this vaccine because they saw decreased efficacy against the variant that's emerged in South Africa. There's been just a lot of conversation about it. AstraZeneca has not yet submitted trial data to the FDA. We are not expecting possible approval of this vaccine here until maybe April at the earliest. You know, we could be surprised a little bit. It could be earlier, it could be later, but there are really strict requirements here related to how many people are enrolled, the amount of safety that follow-up time that we have, et cetera. So that one I think is promising given that it's already in use in some other settings. And then Novavax has been, you know, there's a lot of trials, right, that are still ongoing, but I kind of bring to attention the ones that either have had a lot of U.S. investment or I think show promise. So Novavax initially had some delays in its clinical trials, was having some trouble with manufacturing, but there was a recent British trial that showed really excellent safety, robust protection, again, a little bit less than South Africa. And so there is recruiting still ongoing for the U.S. and Mexico-based trials. They've got more than 20,000 enrolled of the 30,000 needed. The FDA requires that there's follow-up for at least 2 months after people have gotten those vaccine doses. So maybe we could have clinical trial results if it's successful later this spring, maybe another vaccine, possibly by May. And then the last thing is that there are two pretty big vaccine trials here that basically are not moving forward. And this is to help you understand that when we talk about all of these vaccine trials, they are held to very strict standards of safety and efficacy. And if at any point, phase 1, phase 2, phase 3, like we've talked about, there's any concern, certainly related to safety, or it seems like the efficacy doesn't work well, these vaccines will not get authorization, will not move to market. And so Sanofi, GlaxoSmithKline, one of the major ones, has had trials underway, and the safety data has looked very good, but the company said it would really delay any possible release until late 2021 because they were seeing insufficient immune response in the elderly. So it's on hold, it's not moving forward at this point. And then Merck was running 2 different COVID vaccine clinical trials, and just on January 25th also decided to halt those trials. Excellent safety, but just not good enough efficacy. And so they said, these are not as good as the vaccine candidates that we're already seeing in the market, and instead they're focusing on some of the therapeutics and treatment trials. So I hope that's helpful just to give you an overview of some of the main, especially US-based vaccines that we're likely to potentially see coming. federal administration has also put a lot of resources into increasing production of both Pfizer and Moderna. There's been purchasing of a lot of doses, and we're hearing from all corners that by this summer, we fully expect there to be enough vaccine for any American, barring surprises. And so this is some of what we're looking at as we're trying to project out what our own phases could look like. So, okay, enough of me talking. Let's get to your questions. I hope that was helpful, though, just to go over some of the things that we've been getting a lot of questions on. Okay. So, at CPC4 Chicago on Twitter, how soon do you anticipate it will be known if vaccinated people can or cannot transmit COVID to others? Okay, good question. So this, as you know, has been one of the main questions of interest. And there's been some recent data coming out that has been very positive in this regard. So even in the original, which one was it? Moderna trial. There was some data where they had been swabbing people. Obviously, the main outcome is looking for symptomatic COVID infection, right? And all of these vaccines have been shown to be very good and protective against symptomatic COVID infection, and especially against severe COVID. They've all been shown to really limit the likelihood of hospitalization, death after COVID. Really couldn't be more pleased with how these vaccines are performing. But also, just as part, it wasn't the primary endpoint. In the Moderna trial, they were swabbing people who were asymptomatic as they were coming back and looking to see, was there any possibility that they had, you could detect COVID in their nose and then maybe they could transmit it even if they weren't having symptoms. And it suggested some protection there. But those trials are ongoing. But AstraZeneca, actually, speaking of, from the UK, released some very nice data. So the UK has been, partly because of the major surge they've been having there, they've been doing some more with single dose, and there's a lot of conversation internationally about that. At this point, our vaccines here are 2-dose vaccines. You need to get your second dose on time, and that's what we're planning around. But what they found was that in the AstraZeneca trial, after the first dose of vaccine, after a certain amount of time, it was about 78% protective for the individual. I forget if it was 78 or 73. I'm sorry, I don't have it in front of me. But it was in the 70, I think it was either 73 or 78% protective. And then importantly, that same, maybe it was 76. I'm sorry, we will get you the exact number, but it was in the mid-70s, was protective after a single dose for that individual person. But then also, it was about 76% protective in terms of not being able to detect any COVID and therefore people not being able to spread to others. So one of the best data points that we have so far related to that this vaccine, as expected, would protect not only yourself, but would protect others. Just as no vaccine is 100% protective, 95% is amazing. It's about as good as vaccines get. There's also not going to be a vaccine that's going to be 100% protective sort of that other way. We've also been following out of Israel, which has gotten a high percentage of its population vaccinated and has started to see signs also that in vaccinating a large group of people, you see decreased risk in people who did not get vaccinated. So the vaccines are performing as expected, and certainly no reason to think that they would not have some level of protection for others. But of course, we want everybody to get the vaccine as soon as you have the opportunity. Okay. Susanna Leva from Facebook. Are we supposed to register anywhere besides IDPH for vaccination? There's so little understanding about where to register or how to move through the process of actually getting a vaccine in the arm. Okay, so Susanna, if you live in the city of Chicago, I would encourage you to go to chi.gov/COVIDvax. There is a ton of information there related to how to register, how to get information. For one thing, in the city of Chicago, we're using ZocDoc, which is an application that is linking up available doses through healthcare providers here. And we're working to get other healthcare providers on board. It also where we have some publicly available appointments in our City of Chicago point of dispensing sites. If you register on there, even if there are not appointments available right now, which I doubt there are because we've got more than 110,000 people looking for appointments. It will email you. You put in your email, you put in your age, you put in your zip code as vaccine becomes available. And I think that will be a particularly important tool as vaccine supply ramps up and we have more of it available. There also are links to some of the pharmacy websites directly online. And I know that that's frustrating because there's multiple of them. Those are national chains. We are working with some of those chains to try to get them connected into some of the state and local systems, and we've been really pushing hard at the federal level to try to have some of this better coordinated. And then finally, good old Chai COVID Coach. We are directly communicating with folks. That's been a platform we've been using from the beginning. We use it to help monitor symptoms. We use it to push out information related to vaccine. We're looking behind the scenes to see who has registered, who has said they're interested in vaccine opportunities. And again, as more vaccine becomes available, we'll have more opportunities to invite people for vaccination. Your first call, though, really should be to your healthcare provider, particularly if you get care through a hospital here in Chicago. All of our hospitals continue to receive vaccine. They are vaccinating their existing patients, meaning it doesn't have to mean you were hospitalized there. If you have gotten care sort of through an affiliated hospital system, et cetera. And then most of our people, especially those over 65 who've been vaccinated, have been vaccinated by their healthcare provider, where they're actually getting called in for an appointment, as opposed to needing to fight the system, trying to get through the hundreds of thousands of people who are trying to get a very limited number of these online appointments. And then the city is also working to have dedicated employer-based vaccination available. But we balance employer-based vaccination opportunities against obviously vaccination opportunities for our seniors. We look really every week at how vaccine is being used. And then, as you know, as part of Protect Chicago Plus, we are specifically working in some of our hardest hit areas of Chicago that are the most vulnerable to COVID and that are highest risk, that are really driving a lot of our COVID outbreaks still, where we are concerned not just about high-risk settings like long-term cares or homeless shelters or the jail, although we're vaccinating in those settings. We also want to make sure that we are really getting vaccine and good vaccine coverage in some of the hardest hit communities. And so there's dedicated vaccination events there, and that will be something that rolls out further across the city as more vaccine becomes available. Okay. Phase State on Facebook. Will people have a choice as to which vaccine they get, 2 versus 1? So I think you mean maybe like the Johnson & Johnson versus the 2-dose. So broadly speaking, we are trying very hard to have one type of vaccine at a location. Because, think about this, the way you have to handle these vaccines is different, whether it needs to be ultra cold, frozen, refrigerated. The way you have to sort of draw doses up from the vials, the way you may have to, the timing of them is somewhat different. The timing of when you get your second dose is different. We want to make sure people, we're being very careful to make sure we're securing second doses so that people can get them on time. We want people to go back to their same location. So it's not like if you go, they're going to say, do you want Pfizer or do you want Moderna? There's going to be one COVID vaccine available at that location, and that is going to be the one that you take. And the Pfizer and the Moderna vaccine, the same, basically, in terms of safety, in terms of efficacy, in terms of the way that they work. If the Johnson & Johnson vaccine gets authorization, I think it's going to be an interesting conversation, and we can talk some more about this as we actually are able to see the underlying data. Because that one is approved for a 1-dose use, the preliminary data there suggests a protection also in the 70%. I should have brought my numbers in front of me. It's again in that mid 70% protection range with an excellent safety profile after a single dose, which is great. Like, that's better than the protection level after 1 dose of Pfizer or Moderna. But we may be in a setting, for example, where in our highest risk, for example, older people, we may want to really stick to that double dose, right? The Pfizer and the Moderna with the booster to get that 95% efficacy. Maybe we'll be thinking about using the one dose in settings maybe for younger workers, for example. So there will be more to come. This is part of why the CDC and the Advisory Committee on Immunization Practices will weigh in. These are all fantastic vaccines based on the preliminary information that we're seeing, but you can understand there would be different settings where you might want to use sort of 1 versus 2 doses. So bottom line, right now there's only 2 vaccines available. There is no choice. They're both equally good. And once Johnson & Johnson becomes available, we'll be making some decisions based on national guidance about the settings where that one may be available. But bottom line, no vaccine gets approved, authorized, unless it's going to have excellent safety and efficacy. Good question. Karen Towns from Facebook. Can a health department refuse to give you the second dose if you received your first dose at a different site, pharmacy? So I am guessing you are not in the city of Chicago because in the city of Chicago, all of our vaccine is set up so if you get your first dose at a health department site, you'll get your second dose at the health department site. If you get your first dose at the pharmacy, you should get your second dose at the pharmacy. But more broadly speaking, it's not, how shall I frame this? The whole way we direct vaccine is with an assumption that people are getting their second dose on time at the same location. So the problem is because sometimes we get a corollary of this question, what if I get my second dose late? It's okay if you get your second dose a little bit late. There's a little bit of a range around there. If you're getting it within a week or so, not a big deal at all. But we don't want you saying, oh, let me wait 3 months, let me kind of wait and see. Because what we do is we literally say there's a site that did 1,000 first doses, 4 weeks ago of Moderna. We send 1,000 doses to that site to cover the second doses for those people. And it's important that those people sort of show up and get those doses on time, because otherwise what we basically tell our providers is if, we want people to use all the vaccines. So if people don't show up for a second dose, et cetera, they might get used for a first dose. And then you kind of have lost your opportunity to get your second dose. So we really need people as much as possible. It is a best practice, and what we are encouraging every single one of our sites to do is to make that first and second dose appointment at the same time. And let me actually, this wasn't your question, but some misunderstanding that I have heard. People think that there is wasted vaccine, that somehow if they didn't take this vaccine dose at one of our pods, it would get wasted. There is no vaccine being wasted in the city. We've got a wait list of 110,000 people looking to get vaccine. And so you should only be signing up, obviously, if you are eligible. City of Chicago, resident or a worker in these essential worker categories. And then when you come in to get that vaccine, I'll just, behind the scenes, I'll tell you one of our challenges has been that people get that first dose. We want to make sure they get the first dose as soon as they've gotten it. We work with them right then to get their second dose signed up. And we've been using a QR code that lets people get in and get their second dose. The problem is we've been seeing people share that QR code, which is designed for second doses, inappropriately. With friends, with family, and then we get people coming in trying to take up our second dose slots to get their first dose. So we have ways to track that. We've been able to tell people, sorry, this is only for the second dose, we've got to hold it. But I can't emphasize enough, please do not try to game the system. Please do not try to share. If you get a code, if you get an appointment that's been directed for you, when you share that, or if you feel like, oh, I found a secret way to get this, off a message board or something, all you are doing is creating extra work for the health department or for the people who are trying to get vaccine, who need to make sure people can get those second doses on time. The great majority of people have been doing exactly the right thing. But I'll be honest with you, I know there's a lot of demand for vaccine. We do require people to certify that they are eligible. We count on people to be honest when they are doing that. And then we count on people to not try to inappropriately sort of share some of those opportunities. So I'll get off my soapbox. Okay. Jim Capello, and I see some others here too on Facebook, wondering about the shot only lasting 4 months. And also Jim is asking, is it common that the second shot is more powerful, that you will get sick? So, okay, 2 different questions there. No, the shot does not only last 4 months. I'm not sure where anybody is getting that idea from. There is no evidence anywhere that the shot only lasts 4 months. We don't, perhaps where some of the question here is coming is that when people get natural COVID infection, not, they don't get protected from the vaccine, but they've had natural infection, the CDC has, estimated that probably for about 3 months, they have some level of immunity, some level of protection. We still definitely want people to get that vaccine though, even if they've had COVID in the past. With the vaccine, you get a much more predictable immune response, and it's one that we're sort of able to track moving forward. We haven't even had people in the vaccine trials for a year, right? And so in terms of how long does this protection last, we'll be answering that as we move forward. But there's no sign that protection wanes after 4 months at all. I think the question out there is whether we would need a booster dose in the future. That more has to do with the variants question, like the fact that this variant from South Africa is showing somewhat less protection, especially in a couple of the vaccines. Now, both the Moderna and Pfizer vaccine have been tested with that South African variant, and they have continued to show absolutely adequate levels of protection. What's called the neutralizing antibodies are at a level that's good. But still, if we see additional variants emerge, more problems there, got to a point where we actually had a different strain of COVID, that might be a setting down the line. It's possible we could need a booster dose. So the companies are hard at work already figuring out what would need to be done if there needed to be an adjustment in the future to the vaccines because of variants. But right now, the protection looks very good. It looks to be sort of long-lasting other than that. The reason why we need to get flu vaccines every single year is because there are so many different strains of flu circulating that literally every year you look and see which are the most common strains of flu. You make your best guess of what's likely to be circulating that winter, and you make a vaccine against those strains. It's why the flu vaccine is not as protective as the COVID vaccine. The COVID vaccine at this point, there are not other strains. There are variants, but nothing that has shown enough divergence that you would need a completely different vaccine. So time will tell. But right now, if you get those 2 doses of vaccine, you are 95% protected based on those trials. We need people to keep wearing the mask, doing the social distancing, all of that, even 95% protective, which is as good as vaccines get. When there's still a lot of COVID around, there's a 1 in 20 chance if you were exposed, you could still get COVID, right? And so we need people to keep doing those things while we are still in our early stages of vaccinating and still at a high risk state for COVID. But that's the answer. And the question about, is the second shot more powerful that it will get you sick? So I think you're asking about, do we see more side effects after the second dose? Because just to be very clear, right, the COVID vaccine cannot give you COVID. There is no COVID virus in it. But some of the side effects that we see are your immune system learning how to fight off COVID. And there's been some evidence that after this, like the first dose is kind of the priming dose that teaches your immune system. That second dose is the booster that gives you the full protection. And there has been some evidence that people will have more of an immune response after the second dose, but it's certainly not universal. And many people, I got my first dose and my second dose, I had honestly almost nothing. I had a very little bit of a sore arm after first and second, and really nothing else. Some people have had more robust immune responses, and I think people who have a more robust immune response, it's just your immune system is sort of has had a better response and more protection. The biggest difference that we actually see is in older people. Older people tend to have less robust sort of immune response, meaning also less side effects typically. We saw that in the trials. That's continued to play out. It's again, you really want to make sure people have protection. So it's why older people, my guess is probably will continue to be suggested to primarily get that 2-dose vaccine regimen. So even when people have side effects after first dose or second dose, we see them lasting 1 to 2 days and then resolving. And we're not seeing signs at all of people getting seriously ill in ways that continue or in ways that are dangerous. Mitch Arnett on Facebook. Is there talk of mass vaccination sites coming to Chicago, such as Soldier Field, Wrigley Field, etc., like I saw yesterday happening at State Farm Stadium in Arizona? Yeah. So if you saw that green pie and the little bit of vaccine that we have, the answer to that is we have done all of the planning. We have done the walkthroughs. We are completely ready to stand up mass vaccination sites at, we've looked at the United Center. Yes, we've looked at Wrigley Field. Yes, we've looked at McCormick. We've looked at all of these settings. But it's about vaccine. So if we stood up a vaccine site that could do 5,000 doses a day, which we could, operationally we could do that, we only get 6,000 doses a day right now across all of Chicago. And so it doesn't make sense to put 5,000 of those in a mass vac site, which again is really, we see most of the people more with the internet access or willing to drive long distances more likely to access this. We got to make sure we're also pushing vaccine in a dedicated way to higher risk settings, to higher risk communities. So I also think the difference between Arizona and Chicago in February is not small. We've got plans for, as we get into spring and summer, being able to move more of this more outside, which will help a whole lot. One of the biggest operational things is that we monitor people for at least 15 minutes after they get a vaccine. And that really doubles the size that we need to have our sites be, because half of them are taken up by vaccinators and half of them are taken up by the observational space. But yeah, we've done all the planning, and I fully anticipate as more vaccine becomes available, we've put in requests to the federal government through FEMA, thinking about some mass vax support there. This will be something for sure that is in our future in Chicago in one way or another, but it'll be more when there's more vaccine available. Okay, Veronica Carrion from Facebook. Why are people dying with the vaccine? What is the purpose to get vaccinated if you still get the virus? Okay, good question. So let's be really clear that people, I actually like the way you asked this question. Why are people dying with the vaccine as opposed to from the vaccine? Because here's what we see. We do not see people dying as a result of getting this vaccine. But when you give a vaccine to more than 40 million Americans, there are people who will die of heart attacks, of strokes, of getting hit by a car, of whatever else they were going to die from anyway. And especially, let's just be clear, when the campaign is focused on vaccinating older people. We are literally working hard to vaccinate people in their 90s, in their hundreds, in these long-term care facilities. There are people who will die after getting the vaccine. The question is whether the vaccine causes their death, and we have not seen any correlation between getting vaccinated and an increased cause of death. Even in the trials, because these all had tens of thousands of people in them, there were people who died in the vaccine trials, which is why we do a comparison between, remember in the trials, half of the people get the real vaccine, half of the people get a dummy vaccine, a placebo that doesn't have any vaccine in it, and you compare what happens between those two groups. So in one of the vaccine trials, for example, I think 6 people died. 4 of those people were in the placebo group, meaning they didn't even get the real vaccine. 2 people were in the vaccine group. Those deaths did not have anything to do with the vaccine, and in fact, people were more likely to die if they hadn't gotten the vaccine. So I appreciate that question, because I think, it is true that people will continue to die with the vaccine, but not from the vaccine. And all of the follow-on, anytime somebody dies or has any kind of serious medical condition that shortly after vaccination, that is reported, and then there are investigations that are done because it's critical. The FDA, the CDC, everybody watches this really closely. If we were to see any sign that these vaccines were not safe, we would not be using them 100%. And so what is the purpose to get vaccinated if you still get the virus? So the purpose is that you go from, let's think about this. So we've still got thousands and thousands and thousands of people dying from COVID in this country every day. And we've had more than 450,000 people die from COVID. We've had more than 4,500, almost 5,000 people just in Chicago die from COVID. And you compare that to the risk of, dying with the vaccine, from the vaccine. We are not seeing people die as a result of getting vaccinated. And the purpose of getting vaccinated is you are 95% protected against getting that virus. That is amazing. Like, as someone who's been lucky enough, and I know it's hard for those of you who haven't gotten the vaccine, as someone who's been lucky enough to get 2 doses of that vaccine, I'm still being very careful with all of my masking and social distancing, but I don't have that same level of worry that if I get sick, I know I'm very protected, against COVID, especially hospitalization, death. We don't see it. And if I am able to then start seeing people like, my older relatives, my people who have underlying conditions and have less concern that I could be, inadvertently bringing COVID to them, those are fantastic reasons to get the vaccine. And then also, the other purpose of getting vaccinated is that getting Chicago vaccinated is what is going to get us past COVID. And so do it for yourself if you want to protect yourself. Do it for your family if you want to protect your family or your community, or do it for Chicago if you'd like to get back to, pre-COVID ways. The great majority of people who are vaccinated do not get the virus. We actually are working here in Chicago to track anybody who does get the virus after getting vaccinated, even after a single dose. Those numbers have been very low, as expected. We've not seen severe concerns. We've not seen anything out of the ordinary or anything that makes us worry. This vaccine is really proving the safety and the efficacy that we saw in the trials. So thank you for those questions. The last one, because we're at time, Donna Tritz on Facebook. Does having a less robust reaction to the vaccine means it's not as effective? No. So remember, in these trials, what happens is they take blood from all of the volunteers in the trials and they look to see levels, not just of antibodies, but of neutralizing antibodies and the different types of antibodies. And we look at all the different immune responses. And the whole point is that this vaccine is set to a level to give a predictable immune response. So I don't worry just because all I had was a little bit of a sore arm that I'm not protected. I think if you do have a robust response, you could feel like your immune system has learned an even better lesson. But no, that's not something to worry about. So we are at time. Thank you very much for your questions. If we didn't get to them, we are answering them every day on chi.gov/COVIDVax. There's lots of videos, frequently asked questions up there. Again, I urge patience. I promise we're getting to you. We're just a little ways into 1B, and we've got plans to roll it out. And as more vaccine comes, this is going to get more and more. Everybody in Chicago is going to get a vaccine free of charge who wants a vaccine. But it is going to take a few months here. So I think just to end sort of on a positive note, let's just go back and celebrate that Chicago has put more vaccines in arms than we've had cases of COVID, because I was pleased when we passed that landmark the other day. And with that, please stay safe. Keep doing the things you know work. We are looking better here from a COVID perspective, but we are not out of the woods. And we'll be giving some other additional updates through the week. Thanks for tuning in, and we'll see you soon.